think it's just us, sir, and we are live on YouTube.
Okay, so I can continue.
Yes, sir.
Okay. So sorry for that. This sometimes it happened in several things, but anyway, yeah, we lost a little bit time, but doesn't matter, no? Yeah. So good. So the disease classification is you see that the 4 types: the Agandu, the Vata Pitta Kapha things, and that I told about some traumatic things, even stress. No, what happened to me. But anyway, now after 45 days. I'm getting better. My creatine is getting less, and I got a lot of kashaya vastis, like 15 kashaya vastis are over with gomutra vasti, such things and all. And also this experience, what I have, usually I'm doing Panchakarma in Kerala every year, and it may be only 2 weeks. But now I think that in 2 weeks, you cannot do much. This one, even we are following an Ayurvedic lifestyle, but when it comes after 4 weeks or 5 weeks, the effect of Ayurveda is very, very, very too much, really in a good way. So we should even some of the teachers will tell that even an egg has to get a chick. No, it needs time. It needs 28 days. No, so that is something we have to think about that, because in chronic diseases or any such diseases, we need a long-term treatments, not only Panchakarma, the nutrition and all these things. So that is the exogenous with the, and then the, what you call the endogenous, with the Vata Pitta Kapha disbalances. No, so that is something, the 4 types, and then they explain that you can be also one disease, because the common cause, even it is a mental pain or a physical pain, this is pain is the common cause. No? Then it is, which I told you, the Agandu and Nija, and then the site of manifestation, because the somatic, the mana, and the sharira, the body. No, but in one way, every disease is connected with the mana. You know that the body is in the mind, not the mind is in the body. No? So this is what nowadays in the Western countries are getting more, the psychosomatic diseases. You know, so many psychosomatic diseases. You can, so you don't need sometimes much medicines. You have to reach into the conscious level by talking to them, understanding the life and things like this is very, very important, which we usually will not do much here. Because what is a doctor, Ayurveda or allopathy? You come there and you make a prescription and give, and they go for some pharmacies. Even the doctor doesn't know which company they are taking, and all the medicines are inside. So these are all something like trial and error. No, so other one is you have to teach the patient. Teaching the patient is more important than just treating. No, so that is really, really important, and people don't know. Even the poor people or rich people or studied people or whoever it is, they have only an idea that some Ayurveda means some kashayam is coming and some kurambu or some oil is coming. That's all. No, it's an oil therapy, most of them, and this is what also in the whole world. No, and even why it happened, this disease, I got a Candacetan, one of the angiotensin blocking mechanism tablet from Germany, and within 3 days my kidney failure happened, almost 90%. No? So that is a really dangerous condition. But even in that dangerous condition, Ayurveda helped. No? Some people are really interested to do that in a traditional manner. No, but we need the parameters to understand whether it is going into a good condition or in the bad condition. No, so we should show this one with our modern technology. You cannot tell that modern technology is bad. You have to study and we have to see that. But at the same time, a complete traditional way of thinking. No, Ayurveda is a thinking how to develop your thinking capacity. Then there is an innumerable diseases. No, because of the Prakriti, because of the Adhisthana, Dhatu, Linga, all these things, it's innumerable. So we have to explain why it is innumerable. One time it is told like this, one time, yeah, it's like a mathematics, because you have only, Murlis are always to tell that 0 to 9 numbers is there, but you have a infinity of numbers in the mathematics. You have only Vata, Pitta, Kapha, you have an infinity of diseases with its permutations and combinations. No, you have only 51 letters in Sanskrit, and you have an infinity of words. No, so this is important. But how to show that? That's important. No, it's not only that it's my yukti is correct and another person yukti is no. We always hear from the old traditional Vaidya, Saha, you have not studied, you need experience. No, even a young doctor has to understand how it is possible to combine plants, how to understand the disease in this way. Because this, even an old doctor or a traditional doctor, a Vaidya who is giving a medicine, if it is a correct one, then you can explain, you can explore the brain with this concept of with the numbering system in almost all the diseases. No, yeah. So this is what I want to explain much. So that is the classification of diseases. So you see exogenous, for example, it is from the nails, teeth bites, fall, all these things. And this is now also it is possible. Corona or bites and all these things are now also possible even after 5,000 or 10,000 years after. This is always the calamities, natural calamities. No, and we know that this whole world is suffering from some of the exogenous. No, yeah. So the innate is from the Vata, Pitta, Kapha, you know that, but you see this picture, maybe the Kapha, Kapha is a point. Okay, the Kapha is here because earth and water, that's the base, and you go into the hot side or you go into the cold side. Yeah. So when it is going into the too much cold, the Vata imbalances that can be happen. You see Rucha Shida, catabolic disease, dynamic and degenerative. And here it is the Snigdha Ushna, metabolism, thermodynamic and inflammation. So these three are or Vata Pitta diseases or Vata Kapha diseases and Pitta Kapha. This is our life, this one. But when you see the Rucha Ushna, another combination of the gunas, that is death, but a negative word, but it's not death, it is not creation. You are in moksha, you have not Vata Pitta Kapha. Even Vata Pitta Kapha we have, that means it is a disease. You are born means the birth is a disease, according to Ayurveda. No? So that's a little bit difficult to understand sometimes, but birth is a disease because we are playing, we are maintaining these three different combinations of the gunas to balance it. That's very difficult part. No? So this picture, maybe it's for you in my next slides, you should have a feeling of that one. No? So when it is going from from Vata to this Ducha Ushna, or from Pitta to the Rucha Ushna, it's a degeneration. It's completely, you don't have that structure, Rucha Ushna. But here is a Snigdha Shida. So you have a structure. So the three major causes of the diseases, you know that the Asad Maitraya, Samyoga, Prajnavirada, Parinama, like the things which is seasonal and our faults of intellect, no? Ahimsa, from that itself it's starting, no? Ahimsaste anyathagamam, that is itself it is starting, and that is a lot nowadays in the modern world, because we are all running for either for money or either for position, no? Things like that, no? So this is the basic part of Ayurveda, which we always forget in our treatments, we reduced all these important Ayurvedic informations into only a prescription and a doctor for 5 minutes or 3 minutes. It should not be, because we are in Germany and all, the patients give a lot of money for alternative medicine. Give a lot of money for alternative. So you have to give them the idea of Ayurveda, what it happens in Ayurvedic way, and then what we can be done in a long run. Okay, this 4 type of diseases, when aggravated, get transformed into each other to share common symptoms. No, paraspara anubandha. Even then, the different features, for example, the diseases are too clearly manifested to allow any confusion. This is the 6th sloka, but we go on. So this I want to explain it a bit more, the numerical classification of diseases. The Ashtachatvari, Ashtachatvarim Yogadhikarana, Ashtodhariyam chapter. Yeah. This is the chronological order of disease in the Nidhanasthana, the first before this chapter, Mahayoga. So you see the reference is Charaka Samhita I have written, and there is the alimentary tract, you know, that is the Koshta, and then there is the Rasa, then there is the Rasa, Rekta, Mamsa, all these tissues, and then the vital organs and the mind. So our diseases are always in the Koshta, Dhatus, and the Marmas, and the mind. These are the 4 areas of the diseases. So when you put the Charaka Samhita's chapter, like the Ajirna, or Udara, or Jwara, or skin diseases like Kushta, no, Rakta Pitta, you can see that in different areas is there. No, when you say Jwara, that is there in the Koshta also it is started, but then also in the Rasa. No, when it is going into the Rekta, we know that the skin diseases are mostly, it will be there, but the disease goes slowly into different tissues and the mind and all. But when I say that the same color here and here and here and here, even that skin disease and the Jwara, it may be the same amount of ama, but that is in the Rekta, one the skin problems, and the other one is in the plasma. Yeah. So one way, even the amount is the same. If it is 20%, the same, but one is more deeper tissues. But if the amount is increasing, you see the colors are going up. That means it can be a chronic diseases more, no? Or if it is going into this direction, that's also chronic diseases. So a disease in the Majja Dhadu here is more difficult than a disease in the Koshta. If it is a colon cancer is there, and is a brain tumor is there, brain tumor is more difficult than the colon cancer. But still it is chronic. Still it is in the first part of our body, the Koshta. No? Our aim is to bring back from here to here into the Koshta. So all diseases you can, but Charaka or whoever it is, they were not putting all the diseases in this one. So you can also number wise, it is also one, this is also one, but the amount of toxins are different. And this is 1, this is 13, and here is 13. So this 13 is more difficult than this one. Here you need another medicine, here you need another medicine. Here you need another Purvakarma and Panchakarma, here you need another Purvakarma and Panchakarma. So this idea is calculations. No? Even there is no name for the disease, it will come into this puzzle. Even after 5,000 years again, the disease or the symptoms or symptom complex, it will come only in this puzzle. There is nothing extra. So this is the basic understanding for me, actually, to get a understand the disease. Somebody tells I have a knee joint pain, automatically I think about the, okay, you diagnose with it's a muscular pain or a bone joint pain or something, but you reach into a bone joint pain, and even it is osteoarthritis or whatever it is, but it's the pain in the bones, and you come into the level of the asthidhatu. Then you think about a plant, what is really affecting into the bone, because you have ginger, but ginger is mostly in the costa, but rasna, that is more like a bone, but it works in the bone area, asthidhatu. So you change the plant from the ginger, instead of that you put into the, okay, dasna is better. So dasna is more hot than sometimes the ginger. So like this, each plant you can put into the tissues and the vital organs and mind. This is, I don't know how to show this one, but when you think in the same logic, same yukti with the shastra, yukti is not each person's yukti, no. Shastra adhishthidam is yukti. So there should be a basic for the yukti also, the logic also. When you two people are thinking in the same way, if it is correct, then it is easy to communicate. But nowadays it's not like that. You see, even the pulse reading, people are going to Sri Lanka, people are coming to India, and the patients who come to us, they tell that one person told me the prakriti is like that, one person told this, the prakriti is like that, and nobody is talking about vikriti nowadays. So always want to do the prakriti and the treatment for the prakriti, and it is really, really wrongly propagated, because prakriti is always is there. Prakriti is not going to change. Our imbalances has to be changes. That should be cleansed. So this all vikriti I am explaining here with some of the, or to get an idea about the numbers. So this is in the Sanskrit way, like Jwara and Gulma and Kasa. You can put, because I am not sure that everything is the same. Everything is one disease is Udara and Mukharoga. Which one should be first put, or which one is more chronic, that I have to be again to think about, and or to talk with the people who are interested, or if you can also ask some of the old Vaidyas, hello, pepper is more hot or pipali is more hot. So you get a different things. We always tell that both are different, but how? No. So this mathematical puzzle of disease is the infinity of disease with the permutations and combinations. You can go on again 14 up to infinity. You can also go in this way, how much? So this koshta, saptadhatu, trimarma, mana, these are the areas, but mana is always there. That don't forget. Mana is also with the koshta disease and the saptadhatu disease and trimarma. But still, there is also, that the apasmara and unmada and all are really connected with the rajas and tamas. That's also there. So this puzzle we need for the understanding of this kind of explanation, and this is easy to also to give an idea for a modern society, because I have to finish my consultation in Germany within 1 hour, but in 1 hour you have to, because they are paying money, and you have to give an idea about what is Ayurveda, and you have to give the possibility of Ayurveda, or you have to tell that I cannot do that because it is so that all are in this 1 hour. Normally it can be 2 hours or 3 hours, but 1 hour is minimum. So this is the sites of Vata dosha, like the that this Pakwasha, Kadis, Kati, that's the same thing is also in the same slokas is in Charaka, no? Yeah. So it's something which you have to, so when you think about even this picture usually I give to the patient, so people know that where are all the possibility of diseases. No, it is in the ears, it is in the lungs, it is in the what you call bones, or it is in the colon, like this. And if it is pitta, okay, it is in the eyes. So even a person who is having a skin disease, you can ask about what about your eye, or what about your liver, you had a hepatitis. You can always connect with one of the pitta disease with this one, and that makes you the range of percentage of disease, how much it is spread. No, so it's like the same way somebody is telling I have a mucus in the throat, but still you can ask about some other things. Are you dull? No, are you tired? No, your tongue is clotted. So this gives you a complete picture of the disease, not only treating one symptom. No? So this picture also we give to the patients, because patient need an education. Patient understand all these things. Then that same way is the pitta, no? Which I put the same, which I already talked to you. And then the kapha. No? Yeah. So you can also mark here, okay, your problem is you have a tinnitus, okay, your organ is, your ears are, this in German, so this in ears are connected, or you have also your speech, you have a problem, Parkinson, they cannot speak much, but it's connected. Yeah, maybe one or two symptom, one or two organs or something here. So you can value that which is more vata areas or pitta areas, or in the vice versa. No? Good. So the Ashtodhariya chapter, the one before, is 48 general diseases are explained. In Mahayoga, that is single dosha diseases are explained. So there are 140 type of single dosha diseases, including 80 types of vata, 40 types of pitta, and 20 types of kapha. But don't forget that it is not 80 types and all that. No, it is infinity. It can also be combined together. As I told you, in different tissues and different, what you call, costa and different costa and different tissues and manners and this, then again it can be innumerable. But you get an idea that this Nakabheda is from Vada. Okay. No? So somebody tells that my nails are breaking. No? Then you know that there is something going on with Vata. You can easily ask with there is a gas formation in your stomach, or you have a constipation, you have hemorrhoids, and then people tell that, yeah, hemorrhoids I had, and that I have operated. But what is the connection for hemorrhoids and Nakabheda for a normal patient? What is the connection for a modern medical doctor? These two connections. People think that people also sometimes, sir, I have Nakabheda, but why you are telling about my constipation? No, it is connected. So this this information really convinces, because Chinese medicine is like that. In one way, homeopathy is like that. No, and Ayurveda, the mother of medical system, is like that. But we are not using the all part of Ayurveda. No, so there is 80, 40, and 20, but don't think that that's only restricted in this one. No. So then this Nanatmaja Vyathis, which I told you now, the symptoms, no? This is from, you can put it in the costa, no? For example, no? Astringent taste in the mouth, no? It goes to costa. No? If I tell you that Achipeda, tearing pain in the eyes, it can be in the blood, in the recta connected, but at the same time there is a pitta vata, you can, because the pain or tearing pain. No? Yeah, if you tell about urustamba, then it goes into medha. Or so like the diseases you can plan into the different areas. Even a modern disease, which I told you, MS, no, you can plan into which tissues. This guna karmas and the gunas, even you cannot find out that it is in the one of the tissues, look the gunas of the disease. What happens for a multiple sclerosis? Multiple sclerosis, the myelin sheath is gone, no? The wax is gone. What is wax? In Ayurveda, that is something like a sleshma, no? Saumya bhava, that is gone, like a cable is cut. So when what happens? Short circuit, like a what you call, like the vata presentation, no? But the problem is the neurolama or the wax is gone, and then it is a short circuit. Yeah. So the presentation of the patient is, I cannot walk. Yeah. They are not only my nose is paralyzed. It goes from the colon up to the legs because they cannot walk. They are in wheelchair. Why it is a neurology, but where is our neurology? Even it is brain, but for our things are the vata areas, no? The athakaya, that is important. Then comes the vastis. No? Now vasti, what is that? He is putting oil in my colon, and how can he treat the Parkinson's and MS? No? But now people find out that informations what is there in the colon is the same way the brain is working in the modern medicine. So you can put one of the preparation without any digestion into the, no, it is an, you don't say that it is enema. There is nothing to do. This is a procedure is enema. It is an medicine application in the colon. We have to be careful about such words, no? Okay, it is a medical application, medicinal application for the through the colon, like the oral, like the intradermal, intravenous. It is a way of administration of medicine. No? Yeah, that is why it is Arthavagigam, half Chigilsa and all are explained. No? If you put through the mouth, the liver will detoxify. And this is the only way that in some of the cases you can give. And how the medicine is made, it is made into subtle form. You are grinding, or you are churning, only in the direction of the clockwise. No? It's really important. Even in Germany, some of the herbal companies are doing this one, anthroposophy medicine, maybe you might have heard. They are doing in the complete 60% is or 80% is Ayurvedic principles, but they put a name, Rudolf Steiner put a name, anthroposophy medicine. So for minute the medicine, as much as you made into subtlety, like the Gudiga, like the Vasti, no, then the effect is more. No? So such we now how you make a Vasti Drava, no? It is in 5 minutes you make. No, it should be more, no? More time should be grinded and combinations. How many combinations of Vasti is there? Even it is in 14 minutes or 15 minutes or 12 minutes, it is going out. But what happens then? The effect. No? So such things to understand. Why there are so many Vastis, why there are so many plants are explained, why there are combinations are explained, why there are different diseases, and all are easily for a modern generation, according to me, it is well explainable. No? And for me, I am living in a different country, and you have to be very specific and you have to be very fast to give an idea for the patients or the students. No? Yeah. So this is going on. You can also do that one. And when it is going from this yellow color to here, it is the what you call the chronicity or the amount of toxins are increasing. No? Yeah. So like again, yeah. So this is the Vata Pitta Kaphas, different symptoms I put into different tissues. No? This I go a little bit faster. If somebody is interested to understand more, or what is that, or somebody wants to work together as a team with the computer engineers and with the Ayurvedic doctors and all this, really it is possible to explore Ayurveda in its true sense. So this is again, you know that this is the Vata disease, which I explained. And Vatakna Aushadha we need to bring back into this position. Because if you are born, because you are a Snigdashida, you are a Kapha, person. Everybody is having the kapha, not the prakriti. I am telling you, have a structure, and that we are here. No, but the prakriti maybe one person is a 0, one person is a +1, one person is -1. That is your prakriti. It is a constitution. But from the -1, minus is the vata prakriti, -1 is your constitution. And if you are going into this direction, into this direction, your amount of toxins are increasing, or it's overloading or your prakriti, overloading on your prakriti. It's not the prakriti is changing, overloading. The -1, okay, but you have with the food and ahara vihara, you have a lot of toxins, what you call accumulated, that you have to be reduced, and it goes to vata disease. So you need a vatagna aushadha, which is hot or warming. When it is a -1, you need a plus medicine, warming plants. So ginger is plus, and the disease like anaha is minus. So you need the opposite. So always there is a opposite. We explain that, and always we have to think that which is the perfect combination. The avastha, not only the vyadi and the vyadhyavastha, that should be understood. So for this is maybe it's difficult for you how it is possible to understand this which planned. Just think that a disease to find out, you take a combination. Amrudottaram kashayam. You write all the plants, Amrita and Haridagi and ginger, and think about that all three together, what happens? Not only each one, but all three together, it is a warming plant, warming combination, or a cooling combination, or a Shita, or Ruksha, or something like this. Or even first you study with the single things, and then you make it opposite. The opposite is the disease. For example, Musta, no? It is Ruksha Shida and Kadu Vibhaga. So you put it back. So it should be a Snigdha Ushna, and Madhura. So that is a disease. So that is a fever, Jwara. No, so you can take it to opposite, and Musta is very good for this Jwara. But the Jwara can be again different. Jwara can be somebody is light. Then you need not the Musta with the Lakhu Musta. You need a heavy Guru plant. So you combine with this one, Musta, you are combined with another one to get a combination, to get the correct, what you call, opposites of this one. So this is possible either from the yoga to yoga or from yoga to yoga. It needs time. It needs, you have to put your brain inside. No? This is what Ayurveda really explains. Or else for what this BAMS and MD and come into in the last word what the representative, some patent medicines, and that's also in plastic and sugar coated and things like this. How is possible? No, it's not possible that any plastic bottled or capsules or like in Germany and all, you cannot export that one because people think Ayurveda means automatically it is nature. No, so it is biodegradable things, organic things. So there is a concept, no, vegetarian, vegan. So things, this trend is going on more in European countries than in India. No, even the doctors are drinking alcohol and smoking and. Sorry, I have also done previously, but you change that because it's not all the time like that. And then meat and all. So how you are a model for that? How you are a model for a patient? No. So this is the area of uncertainty. No, avyakta, for example. No. Good. So the same, this one functional triad, that means the earth and water. So the principle you put into the universe, the earth and water, and you have here is the fire and water, and here is the ether and akasha and vayu. No, yeah. So akasha vayu, that's the vada and this pitta and this one, and the transformation is here. No, the agni. So agni is the important thing. What can be transformed, and that transformation is always there. No, You know that Agni is the first word explained in Veda, no? In the Rig Veda, the first word. So, and this is the Akasha. So Akasha, you say about, yeah, Akashatna Vidyante, and then the God is Akasha, all these things, our thumb is Akasha. So that causes a good explanation or understanding of even the universe from this one. No? Your Agni is increased in uncontrollable way. You have Pitta diseases called Vidaha. So Vidaha happens here. And here is the Vishtabda happens here. And here is the Sleshma or the Ama happens here. No? But you always balance the three, which cannot be balanced easily. Always, it's a play. It's a, if you have a life with the Vata Pitta Kapha, you cannot tell that I have a long life and this one. No, it is a maintenance. You have to maintain this one. No, you have to always do this. This is a real game. Ayurveda is a real game for to balance your life. You have to live maybe 120 years or 100 years or even 40 years or 60 years, but that should be healthy, no? Not with nowadays we always put in the intensive care unit and with ventilators and with all these heart lung machines and all. The life is, because the increase of lifespan means not only to increase your what you call the age or something. No, because we have old age population is increasing in European countries, but I don't know that anybody is healthy. No, you suppress with the medicines. From one tissue it is coming fever, you take a paracetamol, and that goes into the recta, you get a skin disease next time, and then you suppress this one, it goes to a adenoid or thyroid problems or some nodes, cold nodes like this, and then it goes to the meda, then it is in the fat, then you get a diabetes prameha or things like this. Now, so each time when you suppress each one, then you take insulin, then you take all these things, then it goes slowly to diabetic retinopathy, nephropathy, all these pathies, because it is in the nerve is connected. So it's rasa, recta, mamsa, meda. So disease is increasing, but in one way, it's all the same, one disease. One disease is changing into different names. So no need of name, only to understand how much toxins and in which tissue it is coming. No? Yeah. Then it goes from asti to the majja. Okay. Then you have Alzheimer, Parkinson. So you can explain modern, this connection we only have, only in Ayurveda. Because an Alzheimer is there and he has also a constipation in this one. There is no connection in modern medicine. A skin disease is there and he has, his eyes are also bad. No, it is no connection, but we have that one. No, so this amount of increase is, and then you come into the Shukla Dhatu, it can also be told as such in the total immunity which comes out also from that. And you can say, oh, now it is autoimmune disease. All your seven dhatus are, what happened, it is toxified. Then you need a new body. No, you cannot again do the service of this old car. No, so but every time to doing the service of this with nutrition and Panchakarma is more important. I tell that each of the Ayurveda doctor has to do a Panchakarma, even for prevention. Now, then you know that what is happening in our body. Yeah. So then I go into the Charaka Samhita. Even I am talking directly from the slides because you have to know that the chapter is chapter wise or with the sloka wise. I have done this one, but I don't want to, I told you that I don't want to read that one and explain, but it's almost the same. It's only I put some more information. Yeah, so the vitiated vata should be managed by plants with sweet, and you know that snehana, svedana, and sneha nasya. Nasya also, what is that? Nasal medication is not sinus cleaning. No? So vata reducing, nutrition, abhyangam, utsadanam, parishega. So like different Purva karmas, Panchakarmas, nutrition, all are good for Vata, and that should be adopted. Not only one, no? Not only one thing. No? It is a combination. No? Yeah. So this is again the sloka from the chapter. What is written, like the tree, when cut at the root, result the automatic destruction of the trunk, branches, and sprouts. And so this is we cut in the root, and then the disease is gone. We are not cutting the roots in the normal medical school medicine. We are not cutting. We are only taking out the symptom. No? So it comes new one, because it is traveling from one tissue to the next tissue, like a snake is traveling from one to the next area. No? So this is what, no? So you have to cut out the root. No? So each time, if it is a chronic disease, better is to do not only the medicines, you have to follow the next part, the cleaning or Panchakarma or detoxification, or something should be done to cut out that one. No? That is important. If you have not a chronic disease, then you come, okay, only with the Shamana Chikitsa. So Shamana and Sodhana should be really explained. No? But don't do Shodhana too much for a very less toxins that can also create problem. You know that Panchakarma problems are explained more in Ayurveda, more than the practical aspect of Panchakarma. So this is only for photo representation, Vata Hara Chikitsa, because ghee is important, porridge is important. You see, this different porridge we are giving. No, because here we morning also we eat some doshas and idlis, and okay, some of them are good, but also tasty. But sometimes for the patient we need a little bit more fluidy warm, the porridge. We get, I don't know that so many grains even we are not getting here, because we have kamut, oats, like rice flakes. We get a lot of porridge combinations in Germany, and in that little bit cinnamon, little bit cardamom. So the patient is not only the medicine should be the food. No, food is your medicine. That's what. Yeah. So the food is very, very, very important, because like you have filled a diesel in a petrol car, but you have to take out all the diesel and then only you have to put again the petrol. So like this, you have to change. No, you have to change the food habits. Even you do the Panchakarma, and if you are again eating meat and fish and all, you are detoxifying again, and that can be more dangerous than doing a Panchakarma. So that's important. Or we know that the Karaka Kanyi, Navara Kanyi, and something like this, and the Abhyangam, that is possible, and that Shira, like nutritional or nourishing oil, Nasyas, no, it's also in the Vatahara, like Shirabala, or so. Even a small 1 drop of ghee sometimes works, no. Every day, even normal people who are having not so much Vata disease, even putting a ghee inside the nose, no, it calms our mind and all. Now, only Anutailam is a cleaning, but the nourishing is, you know, that Brahmana, no? Yeah. Then there is a Pilichil or something like this, like Kayasega, and the Shirovasti, because we do more for the MS, the Shirovasti also. And then there is the Vasti, the medicinal therapeutical application in the colon, no? That is important. So it's like this. And the same way is the vitiated pitta also should be with snehana, virechana, kayasega and all, abhyanga. And the plants are more anti-pitta. That means, you know, that it should be a snigdha and anushna or shita, no? Yeah. Like ghee again goes for that, no? Snigdha and shita, no? Milk is go, yeah. But ghee or milk, or and then the plants which we combine. How many plants are there? You can combine, then you get a medicine for the pitta disease. Recently, we made another ghee in Germany, because carde, I don't know that what is the word in English. Carde is a lot used in Germany in borreliosis, that means Lyme disease. And then we made a ghee. So it is like a tiktagam ghee, but it's from our plant. So normally they are giving cardiac capsules, but with the Ayurvedic principles, you make it into a ghee. So this principle should be the explained in we have a medium like ghee and honey and water and milk and oil and all. And when we tell about no modern Ayurveda, we don't use that one. We need always tablets. That will not work. How can you give a tablet for a Vata disease? Because it's that dry substance. No? Okay, I mix with water. These are all some excuses. No? So it should be something like ghee-based or oil-based or aristam-based or something like that. So the principle of the pharmacy should not be forgotten. And the principle of the Ayurveda logic, yukti, and the tattva should not be forgotten. Other one is you are free. You are only in one of the medicine like this one is you are free. You are free to do, free to combine, and you have a lot of possibility. Nobody will control you because in modern medicine you have a control. You have a control from the pharmacy, pharma mafia. So you cannot do so many things. Everywhere it's the same standard and all. Even it is an American or German or Indian, it should be 120 or 140 systole and it should be 80. No, there are difference. People are different. Now only people are understanding there are some differences. No, you are not allowed even, but in India, the modern medical doctors have a little bit more freedom, but in Germany and all, it is only from the slaves of the pharma industry. And Virechana for the Pitta, this, when Pitta is, overcome in the Amasya, and then it is, So this is also from the 16 slokas. And then the Pitta Hara Chikitsa means you see that fruits diet in the morning or some salads with bitter plants. No, this is rucola, rocket or something, and with mango and this one. And you have juices like from mango or plums or something. And you have a Shiradhara for the Pitta. You have a Shirodhara, for example. Or even sometimes Takradara, and then the grapes or something like fruits really, or amla, sorry, this amla, and Brahmi ghee. You see this bottling, this is from Germany. So you have a bio, organic seal, Brahmi ghee, and glass bottle, Cosmoveda. You can also look that how they are making all this Ayurvedic preparation. So this is very attractive, no? And people are buying perfumes for what you call 6,000 rupees, 10,000 rupees. But when you buy some of the things from even it is Ayurvedic pharmacy or Kotakal or something, and if it is 10 rupees in a plastic, this one, people don't think that that is something medicine. No, so the presentation is also important. No, this cost, Brahmi ghee cost maybe 30 euros. That means 2,400 rupees in Indian price. It's a money, but they have done that something, no? So this should be. And then even that your brother or sister or somebody else they have studied different things. They are engineers or they are other professors or something. How you will be accepted in your family, no? So you need that the dignity is more important for Ayurveda doctors. You have to tell that I'm an Ayurveda doctor or Ayurveda physician. No, it's not like always hiding and that's not a possibility. No, you have to explore. You have to tell you are having a very big medicine. Okay. So I think that I have to make a small break. Yeah, is it possible?
Okay, sir.
Yeah, only like 5 minutes or something. Okay. Okay, thank you.
Dear students, we will take a short break of 5 minutes and then we will restart the session.
Okay.
Yes,
Welcome
sir.
back, sir.
Okay. Yeah. Good. So one thing is, if you know the chapter with the slokas, in one way I am explaining in the same way, without the slokas. Maybe when we have time, I will go through the slokas by singing, or because I have a program for that, then it is easy. Or else, if we have no time, just think that this idea were all this, what you call the 80 symptoms and 40 and all these things I have already talked about. And sorry that I couldn't I explained from the sloka to the meaning, but I was thinking that this is the way for somehow a practical approach, or what you can get from the old Charaka into a modern way of understanding. No? But it was my idea. No? But anyway, if you are not understanding, or if you are not, sorry for that, but we continue.
Okay, sir.
Yeah. So the vitiated kapha may be managed. You know that the Udvartana, Utsadana, Lepa, Churna, Sveda, all the drying and the Rucha Ushna Prayogas. No? Yeah. But we should know also this, each treatments are in which area, which avastha, it is important not to do all the things. No? Nowadays, you see that in most of the Ayurveda centers or Ayurveda resorts, you just forget it, because people do things which are not connected, because people are asking for one asyam, can I get one Shirodhara? Like the patient is asking for the doctor only for the money. No? This is so it's nowadays going on. Or when you also see some Panchakarma in Kerala, because we have a Keraliya Panchakarma, okay, that is more as a treatment for our prevention, no? All these Navakkarai and Pirichil and all. Yeah, but some of them are going on. There is no cleaning treatment. There is no Panchakarma at all. No, it's only some Rasayana treatment. So, okay, that's important for some of the diseases. But there should be the area of Shodhana, and after that, the Rasayana. No? So that is something you all have to think about. Yeah. Okay. And then so Vamana is in the kapha is, you know, that it is more effective, and this, no? Yeah. So the sloka 19. And then you have the teas, the several herbal teas, like here is ginger and lemon. For the kapha morning, there is no need of breakfast. You give only a tea, or only a herbal tea. No, these are all we are doing in Germany, because people get with the kapha diseases or kapha predominant diseases. We don't give a breakfast. We give only tea. And if it's a pitta disease, skin disease or something, we give some fruits. And for the vata, we give the porridge. No? So it depends on the disease. It depends on the disease. Yeah, you have different kinds of breakfast. But if you are not having a disease, you are a kapha prakriti or pitta, then also you can follow. Okay, I don't want to take more breakfast. No, yeah. But the conventional, the school medicine always tell that morning the breakfast is important. No, but we know that the 6 o'clock to 10 o'clock is the kapha time. There is no need of a kapha predominant disease or in the kapha prakriti to give a breakfast. So 11 o'clock is much better than one time food. At the evening is only a clear soup. No? Or some lunch like raw foods. No? But also, okay, you know that in the Panchakarma time you cannot give, but in the normal way that is possible. And so like Udvartanam and all, Utsadanam, with oil and this, and Kiris or Pindasvedas, and the Vamana. No? So these are a group of treatments for Kapha Hara Chikitsa. And then there is a Kapha and Pitta. You have to think that which one I have to combine together. When it is Kapha Vada, which one have to combine together. Now all the three, how it goes on. No? Yeah, this is, you know that, and this is, most of you know that, but
excuse me, performance reduced.
Most of you know that this is possible, but the patient also have to understand. No, patient doesn't know that somebody is doing a Kaya Seka, so much oil is pouring, and one time it's Shirodhara. For what? They don't understand. No, they are getting some treatments, and one time it is Pindasveda. No, so the patient should be completely educated in this one. Then you know that the plants, each tissue, Rasa has Musta and Draksha, Haritaki, Asana, and Yasna, Haritaki, and Asana, and Dasna, and Shankubush. Like the 7 tissues, you have, I have written here, I have picturized here 7 plants, but you have 7,000 plants. In each group will be so many plants, not only Musta. And that's a combination. And if it is the Rasadhatu is reduced, then you have milk, then you have Rekta, there is the carrot, you have Ashwagandha to improve the mamsa or ghee, and cow products to improve the madas. So you have a Vruddhi Rogas, which one, and you have a Kshaya Rogas, which plants. And every plant can be grouped into this one. And here also you can give the numbers. The Purva Karma is also like that. If you do a Udvartanam or Garshan, or if you do a Pidichil for Dakta Dhadu and the, what you call the Kiri, Pindasveda, the Rucha, or Garshan in the Medas, and the Navarakiri in the next one, in the Asti. So this is also increasing order of the treatments in the Purva Karma, or for example, so like this, and not only this, sometimes also pouring oil, sometimes also lepas, all are possible. Depends on the dhatus. And also the Panchakarma, the Vamana, you know that in the Rasadhadu, in the Virechana, in the Raktadhadu, and this all, Vastis and Vida Vamana in another one, Rakta Mosha is in the Rakta, But you have to see that where is the disease? The disease is in the Asti Dhatu. You start from there, and then you come back into this position. So the herbs for the Chidya Virechana is like that. I don't want to go. This is in the Apamarga Tanduliya. Even we make the labeling in Germany in this way. And then you have the Vamana Dravyas. Different one. This also you can think about what is more Ushna and what is more Snigdha, like this. So then you do then you need a specific, you get a specific idea of the plants. Herbs for Vamana is also another doctor has explained. This is all in Charaka. You can also look in Charaka online or something. And that's so really nicely written. And then the purgation, for the Virechana, Tavarta and Triphala Dandi, this is also there, that such plants. So he has given a lot of possibilities, not only one or two. There is a lot of possibilities. Why for a Virechana, there's so many plants, but the effect is different. The patient is different, Prakriti is different, the amount of toxin is different. So that's also. And then the herbs for Vasti is also, maybe you might have studied, like the, just I don't want to show too much. Okay. Then you bring back the toxins or the ama or Vidagda ama or Vishtabda ama or whatever it is from one tissue to the next tissue. And sometimes the old diseases or old symptoms can reappear. This is what nowadays happening in the Ayurvedic practices. The patient will think that, okay, I got a fever, then I will go to again to the modern medical doctor, or I have a skin disease again after oil application. This is a coming back, this one, that you have, when you explain this one in the first itself, then patient has no fear, or else they go again into the conventional medicine and take the suppressive preparations, and then again the toxins will be pushed into the tissues. No? So how it is done, all these things, you need a nutrition, number one, you need a herbs, you need a dinacharya, you need a rutucharya, you need something like sattvavajaya, and then you need, what is the picture? Yeah. Then you need yoga asanas. Yeah. Then you need yoga asanas. Then you need a yoga asanas, yoga pranayama, yoga dhyana. Even nowadays, I'm always putting that dhyana and pranayama like this, not the breathing technique or not the meditation. Now, this is more important to give the names as we have. That has more meaning than meditation, no, dhyana. So then there is a holiday in one of the nice places. No, I put here Kerala, and then you have the exercises, what is good for each person. And then there is the Panchakarma, and there is also the pharmacy of Ayurveda. Plus the three, this is the modern medicine. You have a surgery, you have a radiation, and you have a medicine. Either a chemical weapon, either a radiation, or either a surgical weapon. These three things. So all together is integrative medicine. This is what our future. I am not completely agreed that the modern medical doctors are adding these fragments a very like a memory, like an adjunct. That is not the good idea, because modern medical doctors have to study the Ayurveda in a complete form. Then it is the much better idea. No? Yeah, this anyway we are not doing, but then you can combine, then you can work together with a modern medical doctor, because our aim is patient, nothing else. A patient is important and their cure is important. So in that, why don't you ask and cooperate with the other doctors? No? Even in India, there are several modern medical doctors interested in Ayurveda. But you explain, even in your clinic or in their clinic or in the medical hospitals, when you work together, this is not an integration, because it's a complementary, because they will, you know, you see the Medanta in Delhi, you see the several hospitals here also, no? Yeah. Teams and all, yeah. So the nutrition, you know that balanced Ayurveda nutrition, you have or you go for the organic vegetables or something if it is possible, and you herbs and spice, you explain what is the ginger effect of turmeric, effect of cumin. So cumin. Now this the patients or the people and the public has to understand. It's not only ginger is food for taste or turmeric. So this is important. Dinacharya has to be, this should be adopted, or in the school level they have to. Then only we get a healthy society. Now we cannot tell that I'm not doing that, I'm only sitting in a clinic. This should be, each student has to understand, each public has to understand the dinacharya. No, yeah, maybe you are not making money from dinacharya, but that is secondary. No, secondary. Money is secondary. It comes. Then the rutucharya, no, changes of the seasons and what can be done, and for the prevention, people will come for that. Then you have a medical wellness holidays, not the wellness holidays, medical wellness holidays. That means you also involved with some of the, not some of the medicinal wellness, not simply wellness. And in some resorts you go and you drink a cocktail and mocktail and cross massages and all. That is really creating problem into the outside of India. For the Ayurveda as a bad name. Panchakarma, That is, I told you, for the prevention and for chronic diseases. No, yeah. You have a car that you have to do the oil service every, I don't know, every month, every 6 months, or at least you have to clean. And you have a body which is 120 years. You can do that, maintain, no, and that you have to cleanse or make a, what you call, make a rust, or no. Yeah, this is very, very important for this. No? Yeah, this is what the whole Ayurveda is explained. Even it is Charaka has explained a lot of philosophy. Think that this part, more than Vagbada or Susruta, he put a life, how to understand the life. Even Ayurveda is A plus Vayu plus Veda. You see, you have a Vayu, you have to maintain that. Then only you have an Ayu. So Panchakarma, you know, that's a cleansing, and don't forget there is an Amapajana, Purva Karma, Panchakarma, Paschat Karma. Nowadays, people are only doing the Purva Karma, only the oil treatments, and forget about other things. So you mobilize the toxins and you are not cleansing out. That's the problem. But this should be in this way, in this proper order. Yogasanas, you have to explain what is Mayurasana, Apanasana, what happens into the body, the yoga therapies. No? Yeah. And then you have so many things like vata reducing yoga postures. When you are on the earth level, you are working all these things. That is more stability, and that is more for the vata. But when you are standing postures or something, it is more for the kapha. No? So like pitta and then the karma yogas. No? So think that this is a multi-modalities of Ayurveda. It's not separate and fragments. Somebody is doing vegan, but they don't know anything about Ayurveda. Somebody is doing a pranayama, they don't have any idea with the Ayurveda. That should not be. It is a combined effort. The mudras, no? Pranayamas, no? Kapalabhati is there, Shidali is there, Anuloma is there. Because in one day you are giving in different way the medicines and the diet and all, so the patient get more energy. You see, I was in this Maitra hospital or in Germany or here. You are in an AC room and you are filling up the stomach again, and you have no air, you have no sun, you have nothing. You are only in one room, so you are mostly bedridden. No, you need all these 5 elements, because when I am here now, it's very nice place, and you have a pond with lotus, and also you mentally, physically, you are really relaxed. No, even in you have a clinic or small clinic, this should be there in a way. Not only the medicine. There should be a little bit ambient, and yeah. So karma yogas, this, you know, and yoga dhyana, no. So like step by step, you cannot put a yoga dhyana and immediately to a patient. It should be from one to the next. You can start with the nutrition. If they are not doing the nutrition, forget about the patients. You don't need that patient. No? Why they should have the fish and at the same time kashayam? There is no need, because they have to change. Change is very important. And then the Raja Yoga, like Pratyahara, Dharana. Now, this is step by step. Don't put all the philosophical or higher yogas and things like this to a patient, because they have to digest this. No, you have the knowledge, but you don't give that immediately, everything. No, and then the Sattva-vijaya, like dhyanas and Raja Yogas again. No, you go from body to mind to the soul. The body is more with Ayurveda and the mind is more with yoga, no? Not the asanas. Yoga, asana is again for body, but yoga, the higher yogas. And then you know yourself, that is the Atma or the soul. No? But that is really a difficult part, you know. But it should be step by step. No? Then is the Deva Prabhasraya. When we tell about Deva Prabhasraya, nobody will do that. Oh, mantras and homas and how it works, or no, it is a hocus pocus, this is esoteric. No, because at a particular time, you know that Purva Janma Kritam Papam, that is what the things are coming. So even my problem, it is something has happened in the previously. So you have to do some of the things for your mind to calm. So there is the Jnana Yoga, Sanskrit alphabet, Bhagavad Gita, Sankhya Darshanas, things like we have a lot of information in India. India is worshipped outside or respected outside, not because of IT technology or nothing like that. India is outside understood or interested is because of our Vedic culture and the Bhakti Yoga. So we have to decode Ayurveda for the knowledge of life. We have to decode the Sthapatya Veda for the knowledge of positions, Hora Shastra for the knowledge of cosmos, and the Sangeeta Shastra for the knowledge of sound. Each one is medicine. The Nritya Shastra, knowledge of symbols, and Ved to self, and theory of self, and the self itself. So these are all some of the ideas what I want to tell. And I told you that in Germany I have a center, and maybe in 2 years or something I am coming back, and I'll be starting a center in Palakkad. That is the name of Ayurveda. It is a village. We want to make it with the Ayurveda village with the plantation and everything. Almost all the work is over, but it takes time, a little bit more. So this is some of my things what I have to achieve in this life, or else, it's only an ambition for this. And now I really appreciate Dr. Krishnakumarji, because without him, because I never come into Ayurveda. I might have an engineer, or I'll be in US or UK or even in India. I don't know. And you have no idea about what is India. But he told me that for this course, Murali sir, and he only directed for this one. And his words are also important. The Vaidya is a guardian, messenger, and practitioner of authentic Ayurveda. A Vaidya, because that is important. It's not even he is a owner of one of the biggest company. He was not telling about the products. The product is the students and doctors. That should be. Vishak Dravyanuvas. That is the important, not the Dravya. Nowadays, all business people are Dravya. That is not at all needed. This is one. And then the Musatsar, do not consider Vata Pitta Kapha only, consider the Guna Karma Vikalpa. There will be a day when even the American president will bow to Ayurveda. Musatsar was telling in 1982 in my class. And then at the time we were really laughing. American president will come to Ayurveda. But now I see that the world is really, really interested. And the Murali sir, everything in the world is only properties, guna. Its permutations and combinations are only the functions and structures. Reasonable, rational theories, that is Ayurveda. Not empirical at all. Like mathematics, 1 to 9 is a linear development of numbers. Same way is the disease also, Murali sir. Another teacher of me is Shashi sir. If you do not follow the fundamental theoretical principles of Ayurveda, it is difficult to follow the Nidana, Panchaka, and Dravya Guna. If you do not follow the fundamental theoretical principles of Ayurveda, it is difficult to follow the Nidana, Panchaka, and Dravya Guna. Dhatu Samya is very important. That is Samanya Vishesha. If you know exact formula of a combination of yoga, it is also possible to add or deduct the plants, depends on the different disease condition. These words made me to think about how it's possible, what is happening into a Vaidya's brain, how he is adding and how he is reducing, how it is a new plant can be used in this one, how a disease can be grouped into this way, what is a small disease and what is a big disease. I always prefer Charaka Samhita because it is elaborate and dealing with the individual and the universe. Every Indian Shastra has 2 dimensions, Vyashti and Samashti, individual and collectiveness, the diversity and uniformity. This idea is projected in Charaka Samhita, Vasudevan sir. You have seen that in the last time in the chapter, I don't know which one it was, I think Trishopian. Yeah. Then Gangadharan, also from our college, you should see the doshas in everything. No? Doshas you should see in everything. More than doshas, the gunas you have to see. Guna karmas you have to see. In one way it is the same. No? Ramanohar, health is an orderly order. So it is going from koshta to dhadus to, like this it is going on. And disease is an orderly disorder. So how it goes from one tissue to the next tissue. And the death is a disorderly disorder. You don't know what happens tomorrow. Then it is disorderly disorder. So this is from Ramanohar. And Ramaprasad, maybe you know him from, he is from Australia. The instruction manual of body and mind is Ayurveda, because you have a manual for everything, for computers and things like this. But Ayurveda is the instruction how to deal your life. If something is imbalanced, troubleshooting, you have to intervene something. No, that is the part of Ayurveda. In modern medicine, you need a disease, then only you can treat. Without disease, there is nothing existing that. No, you need a disease. But in Ayurveda, it's not like that. You don't need a disease. You don't need a symptom. You also, your life, you can be maintained with this one. No? This is one interesting sentence also. David Frawley, Ayurveda is the traditional yogic system. Physical body, subtle body, prana, mind and senses, and jivatma and paramatma. No? It's a traditional yogic system in one way. There is no pill for every ill, but there is nil following every pill. V.M. Hegde. Maybe you know him also. And then the Naresh Tahran from Medanda Hospital, New Delhi. Modern medicine, it's high-tech research, documentation, active ingredients. If you have a disease, either we poison it by antibiotics or chemotherapy, or I will cut it out with very good surgical skills, or I will shoot with the most powerful X-ray beam. That means you have no role to play in your disease or in fighting your disease. I will take over and I will do that. I may treat you, cure you, but I make a big collateral damage to you. Can we find a fusion with the traditional system of medicine? This is Naresh Tahran. He is one of the 5 doctors in the world. No? And he is in Medanda. I don't know that you know him, but anyway, Dr. Geeta Krishnan, he started there with Ayurveda in this one of the biggest hospitals in Medanda. But now the Geeta Krishnan has gone into the WHO. No? Yeah. He has also a connected research in Germany for MS and Parkinson with another neurologist, no? But with Ayurveda. No? So you see, people are interested in modern medicine. Deepak Chopra, none of the atoms are in your body you are born with. They are manufactured in the crucible of some stars. Once you understand the body is a process, you engage in reinventing the body from limbic system. The most fundamental things are sleep, meditation, movement, emotional well-being. This is what we have to give to the patient. No? This idea of a good sleep, meditation, movement, and emotional well-being. No? You can also put it into 3 hormones like the oxytocin and dopamine and serotonin, which balances. No?
Excuse me, low battery.
Ooh, low battery. Yeah.
Excuse.
Then Dr. Gangadharan is a pediatrician. Children are the future of every nation, or the health of children is more important than any other thing. Health of children. No? When the business comes in the medical sciences, the purpose of doctors are lost, either in allopathy or in Ayurveda. To make money, there are several methods, but not a service-oriented medical system. Vaidyamadam Charyanarayan Nambudiri, with whom also I have worked for 1 year, and before starting my clinic and all. And the chronicity of disorders are in horizontal order. Chronicity of which I have shown you the puzzle, mathematical. Acute and going to complications are in vertical order. Samhita is a picturization of immersing in a knowledge by Guru and Shishya. The practice is your freedom of choice after understanding the fundamentals. So I stop sharing. So I think that this part is over without slokas. And I am very, very extremely sorry that the sloka and the explanation, but if you got the idea what I have explained and then you read the sloka, it is there inside. No? And I feel like this to explain. And if you don't find it's not interesting, I'm sorry. Now you have some questions or something, I will try to answer. So thanks a lot.
Thank you,
And
sir.
yeah.
That was a wonderful and informative session, and we all thoroughly enjoyed, and we all learned a lot from that as well. There is a question from Dr. Rajeshri. So
Okay.
she's asking, I think it is from the context where you were explaining the management of different doshas by gunas and karmas. So she asked about how is the management of vata and kapha together.
Vata and kapha together. You have to think about which dosha is predominant. For example, when it is vata and vata, the pain, and for example, amavata is important, or it is how much in which tissues, in which dhatu this is. If it is in the asti dhatu, you have to start with the vata treatment little bit, or you give a kashayam, for example. You don't give an amrutotharam kashayam because it is more dry, but you give a Belaguduchadi or Rasnadi, or what is the exact gunas inside. If it is a cooling, more cooling, both are cold, the vata and kapha, but it is more cold and in astidhadu. You give a kashayam. Kashayam is important for kapha reduction, but at the same time, the plants you are using as snigdha ushna, no, not the rucha ushna, snigdha ushna. So you reduces the vata, but you don't give a long time this kashayam because you know that kashayam dries up. So it may be in 3 weeks or 2 weeks or something till the symptoms reduce, and then you start the vata treatment. So this is in one way vata kapha is more easier than vata pitta, no? Because that is more, because one is heating and one is cooling, no? That is more. But if it is a kapha vata, if it is a person with obesity and pain in the knee and all, then you have to reduce the kapha more instead of thinking about vata first. But still, you give a kashayam, maybe the amrutotharam kashayam, chitragadi kashayam, something like this. But you can also, not the big combinations, you can also make a combination. Yeah.
Excuse me, temperature.
Yeah, so like amrutotharam, then you think about, okay, amrut, haridaki and ginger. Okay, but ginger I take it out and I put a rasna for that, this combination. Or he has more constipation and all, then you put the harita kyadi kashayam, haridaki more, amrut less, and you can play a lot with combinations, and you can also with the grams, how much plants you take from 1 to 1. But you have a prepared kashayam, then you have no freedom, no? So this is possible even in a vata kapha. You have to think about which one is dominant and in which tissue it is there, and which one I start first, but never create a problem of the subdoshas. I think that's it's explaining for you, no?
Okay, sir. Dr. Rohini, can you ask the question?
Hello?
Sir, this is from Dr. Bhaswati. So she's asking, oh no, more or less she's commenting, why has no one written lucidly about the mathematics of Ayurvedic diagnosis and dosha dhatu approach to treatment? If mathematics is so clean, why don't we more people know about it?
Yeah, this is something, because if somebody else is, if not not myself, another person is explaining, maybe he will find another way of explanation. Maybe a physicist will find a different way of explanation. But this is not Ayurveda. If you write, even putting a number for it, then you are again restricted. This is your intuition you are putting into this. So people have to work together, and that is a possibility, because I don't know that anybody has done in this way. We have only the computer based diagnosis and things like this and all, but in one way, even the Madhava Ayurveda, what you call the software, even what is behind in this symptoms, if you put a symptom like anaha, or if you put a symptom of shula, what is happening inside is the weightage given for each symptoms. Weightage, one is 1 or 1, you see the computer is 0 and 1. So that is inside always. Always there is a Sankhya. Even the Ayurveda is explaining about what you call Prakriti and Purusha 2, and this one 24 Chaturvimshati, 24 tattvas or 7 dhadus. Always there is the numbers, but we forget in one particular time. Okay, Jwara for Jeevan is different. Jwara for Mardula is different, or something like this. But what is the difference? We have so many parameters as to, it's not only putting number, we have to take a lot of factors to come into a number. So that has to be, that is more easier to understand, according to me. And people have to work, or else we go on with we need the slokas, we need the tattvas and everything. And this is the next step. Okay.
Thank you, sir. Sir, there are no more questions from students. It is actually a very wonderful view of Ayurveda in a very different perspective, which is, I think, opening our minds and our viewpoints to more possibilities that can be done, and that the future is not so bleak after all. Thank you, sir. Thank you for
okay. Thank you.
Thank you for joining us for Samhita Tattva Vichara. Thank you.
Namaste.
In the session now, and the Samhita Tattva Vichara will resume next week. The organizers once again apologize for the incident that was in the middle of the class. Let us move on into a better class from now on. Thank you so much.